here's an obvious question that I'm sure a lot of people out there are asking, because you obviously explained that this organ helps break down foods and helps with our digestion, right?
Definitely.
So check. So how does the body continue to do this if you've now removed this little organ? That's so important.
It is. What happens is the liver actually is the really smart organ. That's the one that takes over the job of it. And basically that's why we tell patients after their surgery for about a month to try and have a low-fat diet. And the reason is that the liver is taking over that job of the gallbladder. And what happens is that the liver can respond then to the stomach and then push the bile out that's necessary. Without the gallbladder, the body will adjust to this.
So you can obviously live a normal.
For sure.
There's really no consequence of not having your gallbladder, right?
No, I mean very rarely, and it's usually about 1 in like 250 to 300 patients. So it's like one of our patients, since we do a lot of surgeries every 2 to 3 years, they will just have persistent loose stools. Now, if this comes in, like for instance, as females are much more common to have constipation, this can be a blessing for some people because then their constipation with a little bit of the looser stools makes them have regular bowel movements and then they feel wonderful. But some people don't and they have persistent loose stools, and then there's a medication they have to take all the time. So it's very uncommon, again, about 1 in 200 to 300 patients, and we never know who it's going to be, so it can happen.